Hi guys, today we're going to discuss the most important features of the cervical plexus. In the first segment of the video, we are going to go over the general data so you can get a nice basic understanding, and then we'll cover a bit deeper the anatomy of the region, followed by some clinical perspectives so you can link the theoretical and practical knowledge in your head, which would make it easier to remember, of course, and more useful long term. First, I would like for us to define what is a plexus. Just let me get a piece of paper. Now you all know how the spinal cord looks like, right? The ventral and the dorsal horns. And of course, all of those would give you the spinal cord nerves, right? And these nerves would split into dorsal and ventral branches. Now, the nervous plexi are interconnected nerves that originate from the ventral branches of the spinal cord nerves. And that's pretty much it. So in this case, the cervical plexus is a nervous plexus that arises from level C1 to C4. Right? So the first four cervical ventral branches would give you the cervical plexus. And that's pretty much it. Now, what you can see on the drawing, which I tried my best to do, but it's not perfect still, you can see a transection of the neck at around C3, C4, let's say, right? You can see the carotid artery with the superior vena cava and the muscles of the neck, which of course are written, so I won't waste time explaining them. Now, in the central canal, you have the spinal cord, of course, and you have the fascias of the neck. You have the deep fascias here, of course, the investing fascia, the prevertebral fascia, and the visceral fascia. And of course, some of the deep muscles. Now, we all know that when two vertebrae are stuck next to each other, we get a small opening in between them, and this opening is called the intervertebral foramen. So, through the intervertebral foramens, these ventral branches would come out and kind of be positioned next to the deep muscles of the neck underneath the fascia, the prevertebral fascia. Now, as usual, when a nerve is quite close to a muscle, it would be kind of dumb if it's not innervated by that nerve, right? So since the cervical plexus is close to these deep neck muscles, the deep neck muscles, of course, are innervated by its branches, right? And then you can see that some of the branches kind of pierce the prevertebral fascia, or some of them end in the sternocleidomastoid muscles, but you can see that some of them kind of loop behind the muscle, again pierce the investing fascia and end up in the subcutaneous fatty tissue just underneath the skin. Now, if you see a nervous branch underneath the skin, what you're going to think about, that this is probably a sensory branch, right? It innervates the skin, so sensory. In general, then, if we have to summarize, the cervical plexus will have a motor part and it will have a sensory part. And let's go first over the motor part because it's easier to explain, I don't know, or at least I'd like it better. And after that, we can go over the sensory part. Now, if you take a look at, just give me a second to rearrange the sheets of paper. Yep, ready? So if you take a look at this diagram here, you would see that I've called them deep branches. Now, why are those muscular portions known as deep branches? Well, look where they are located, right? They're like deep in between the neck muscles. So hence deep branches. And of course, the sensory branches, which are just underneath the skin, would be called superficial branches, which again makes sense, right? So the deep branches can be medial or lateral. The medial innervate usually things which are closer to the vertebra, and the lateral usually innervate things which are further away from the vertebra, like the sternocleidomastoid or the trapeze, which would be around here if I have drawn it, right? So the medial group would innervate these deep cervical muscles like the rectus muscles, lateral and anterior, and the longus muscles, the longus capitis and longus cervicis. While the lateral group would innervate the sternocleidomastoid, the trapeze, the scalene, one of the scalene muscles, and the levator scapula. before we go over that guy here, which is kind of escaping the general trend here, if you think about it, all of these muscles are muscles which help with movements of the head, right? Actually, not of the head, but of the neck, and the neck, of course, moves the head. So, in general, if you have some damage there, you would expect that you would have some motor deficiencies, let's say like that, in this area, right? Which means that could be something interesting that we will go over a bit later. And the one thing that escapes the trend, as I mentioned, is the phrenic nerve, right? Interestingly, the cervical plexus also innervates the diaphragm, and you will see that one of these branches goes straight down the thoracic cavity and ends up in the diaphragm. And that's pretty much most of the motor components. Of course, since it innervates the diaphragm, we wouldn't be thrilled if this nerve is damaged, right? Or the plexus is damaged, because your diaphragm is kind of important for breathing and stuff. And that's pretty much it as far as the major motor things go. There's another group of muscles which are found in the neck that's also innervated by the plexus itself, but by another structure which has a very peculiar name. And these muscles which you see here are the muscles that are innervated by this structure, and this structure is known as the cervical ansa, or the cervical loop, or ansa cervicalis, depending on where you read it from. Now, what I've tried to draw here are the vertebra, right? And on this side you have the hyoid bone and the sternum. So there is a group of muscles which stretch in between the hyoid bone and the sternum, which are called the infrahyoid muscles. And those infrahyoid muscles are 4 in total. Of course, you can see them here, right? There is one exception to the rule that they stretch between the hyoid bone and the sternum, and that's the omohyoid, because this muscle goes towards your shoulder, towards the acromion. Now, those muscles would be innervated by ansa cervicalis. What is the cervical loop? What is the cervical ansa? It's a structure that's formed by 2 branches. You can see that on the schematic here, you have C1 and part of C2 going up and close to a structure called the hypoglossal nerve. And they actually join the hypoglossal nerve, and they go along with it for a while, and then they diverge from it. That happens rather often with nerves. Nerve fibers from different nerves join to other nerves that are in the area. They hitchhike for a while, and they split off and go towards their desired destination if needed, right? So you would see that one of the nerves go like that, and C2 and C3 would go over vena cava. What's worth mentioning that the hypoglossal nerve is underneath vena cava, so you'd have one of this branch going kind of underneath, and this branch going kind of over it, and basically they would encircle vena cava. So you won't see it like that exactly. What would happen during your dissections, you would see vena cava, and over it you would see kind of a loop that's stuck to the anterior wall of the vein like that, and that would be the cervical plexus. Sorry, not the cervical plexus, the cervical ansa. Now, from the cervical ansa, you would see several branches going out, and these branches would enter different infrahyoid muscles. So if we have to summarize, they would be innervated by this structure. And of course, the ansa would have, I forgot to mention that, but it would have 2 roots, right? A superior root and an inferior root. And I guess that's self-explanatory, right? The hypoglossal nerve lies higher than these structures here, so the guy that comes from the top would be called superior, and the guy that comes from the bottom would be called inferior. Now, and that pretty much covers the entire sensory component. The last portion that we would need to discuss is, this covers the motor component, and the last portion that we have to discuss is the sensory component. Before we go over that, what I want to mention, actually to remind you that part of the nerves, the sensor nerves, pierce the superficial, the investing fascia behind the sternocleidomastoid muscle. And there are four of these nerves, right? The minor occipital, the supraclavicular, the transverse cervical, and the major auricular. These are the sensory nerves of the cervical plexus. And all of them would do that. But it happens around a small point behind the sternocleidomastoid muscle, behind the posterior edge of the sternocleidomastoid muscle. And since this convergence of nerves there is called the nerve point of the neck. So let's start one by one and discuss those nerves. The minor occipital nerve is the one that would start behind the edge and go straight back to the back of the head, the occipital region. And again, let me get a piece of paper. There are three occipital nerves, right? You have the minor occipital, you have the major occipital, and you have the tertiary occipital nerve. Now, if you imagine your occipital region like a trapeze, let's say, something like that, for example, and you split it in two, right, left and right, you can do something like that. So the tertiary occipital would innervate this part, the major this part, and the minor this part, right? So in general, the minor occipital nerve would innervate the lateralmost part of the occipital region. The supraclavicular go straight down towards the clavicle, and these guys, there are actually three of them. They would be called lateral, medial, and intermediate supraclavicular nerves, and they would innervate the skin around the clavicle, the skin around the shoulder, the acromion, and a little bit of the pectoral region up until the third, fourth rib. So basically this neckish part of the area. The supraclavicular, we discussed the transverse cervical would make a loop like that. So if my fingers are the sternocleidomastoid muscle, what you're going to see on your dissections is basically a nerve that goes like that, right? So it's kind of enclosed, entrapped by this nervous loop, and this nerve is called the transverse colli nerve, and it would innervate the anterior portion of the neck. The last one, the major auricular nerve, goes towards the ear, goes behind the ear actually, and would again innervate this area, right? So if we have to summarize, you can see that most of these kind of innervate neck-ish portions of the neck. Neckish portions, the neck portions of the body, sorry. And mostly the anterior part, right? Not the posterior part, because the posterior part is innervated by the dorsal branches of the spinal cord nerves, right? And this is a structural movement of the ventral branches. Usually ventral branches innervate ventral structures, dorsal branches innervate dorsal structures. So the ventralmost part of the neck would be innervated by the skin, of course, by the cervical plexus. And that's pretty much it as far as the major anatomical features are concerned. Now, having that in mind, I will just leave this guy here, and let me take this guy and put it on the back here so we can do something else. And that's that. You have several interesting conditions, not interesting, but several conditions, some of them more interesting than others, that are based on the anatomy, or at least explained by the anatomy of the plexus. Now, torticollis is called is something which is an involuntary twisting from the head, right? Basically, your head is stuck in a semi-contorted position. And why that happens? Well, you have several reasons, but the one that we're going to cover today is the one that's linked to your cervical plexus, and that's damage of the plexus, right? You can imagine that if you damage the structure that innervates the muscles of the neck, there is a high chance that your neck won't move properly, right? A second interesting thing is let's go over the neuralgia first, the cervicogenic neuralgia. Now, neuralgia is this very unpleasant, burning, painful sensation that you feel on your skin when you have a pinched nerve, it's called, right? When you have an entrapped nerve, an irritated nerve, right? And what can happen here is that different conditions, let's say like a trauma to the region or inflammation, which resulted in some connective tissue adhesions or something. What else? Degenerative disease, the spinal column, right, could irritate the region. Inflamed lymph nodes can irritate the region. Something that's not very nice to discuss, but still tumor growth, right, which infiltrates the region, can irritate the plexus, right? So everything that can irritate the plexus, that can kind of pinch the nerve, to put it like that, which is not very correct, but let's do this example, can cause the nerve to flare up and you'll get this neuralgia. But where the pain would be located, I think at this point you're more than capable of discussing the location of the pain, right, based on the nerves that we already covered. The cervicogenic headaches are something interesting as well. They're a bit hard to explain. If you want to go over the region of these type of pains, just leave me a comment down below and I will make a video. But in general, in this particular case, some of the fibers of the cervical nerve, of the cervical plexus nerve, and fibers of the trigeminal nerve, which is responsible for innervating out of the, how to put it, out of the skin of the head, right, out of the air of the head, and as well as the blood vessels in the brain are converging towards similar neurons, right? So if you have a neuron here, on this neuron, you might have fibers from the cervical plexus that are connected to it, and fibers from the trigeminal nerve that are connected to it, right? And so you can see how pain can spread from one region to another region. And that's kind of a little bit of an easier explanation, easier way to explain. But in general, again, if you have an irritation of the region, which we discussed why can happen, you can get a headache. A plexus block is something that's quite useful in anesthesia. If you're doing a minor surgery in a region, instead, let's say on the arm or some superficial neck surgery or on the lower leg, instead of putting a patient under general anesthesia, you can just try and knock out the plexus itself, right? The thing that supplies the entire region. And in this case, you can anesthetize the cervical plexus. The way the way that this is done, and I would encourage you to look at the picture of it. I would actually send a link in the description so you can check out. Under ultrasound, you would perfectly see the sternocleidomastoid muscle, right? And you would perfectly see the two fascias here, the prevertebral and the investing fascia. So if you go with a needle underneath the sternocleidomastoid, where, of course, behind the posterior edge of the muscle, right, around the middle, you could inject a little bit of anesthetic in this space there, and that would knock out all of these four nerves, right? So the anterior portion of the neck would be kind of good to go. Something that's important is don't go too far in, because I think you see why, right? That wouldn't be the best idea. But in general, that's a plexus block, right? Now, it could be done as well. I think at the time, if I'm not mistaken, you could do it like that, go deep and knock out the muscles as well. I don't think it's done now, mainly because you have ultrasound, which makes it easier to locate this more precise space, first of all. And second of all, you do have the phrenic nerve there, originating from here, right? And although it won't be life-threatening as far as I know, you still don't want to put your patient under more strain than needed, right? And the last thing that's kind of good to discuss, actually we won't discuss it, but I found about it during doing some research for the video, is the gustatory sweating. Now I will leave that for homework. This is very rare, as far as I know. It's just something interesting that would be explained very well by the anatomy of the region, right? Because there, apart from the cervical plexus, you have more nerves, and that could be interesting to see. Okay, so that's the end of the video. I hope it was useful. First of all, I have two things to say. If you found something that you didn't like or something that you enjoyed quite a lot, please leave those in the comments so I know what to correct for the next time, for the next videos actually. And if you have any suggestions, again, I would be more than happy to see them again in the comment sections. And I hope that was very useful for you, or at least mildly useful for you. And have a nice day and be productive.